So apparently repeal and replace is not as easy as Republicans thought it might be. A bit of a debacle going on in Washington right now. Nolan, I'm going to start with you. And a lot of it is hinging on what could happen to Medicaid in the Senate plan and how many people are not going to be insured and how much it is going to end up costing the federal government, and especially here in Michigan. I mean, we are watching because we were one of those Republican-led states that did expand Medicaid.
But everyone has to start from the reality that Medicaid cannot keep expanding at the rate it has been. Obama added 30% more people to the rolls of Medicaid, now insuring 1 in 4 people. We spend something like $360 billion on Medicaid, projected to almost double over the next 10 years. The states can't afford that. The Republicans have a plan, whether it's a perfect plan or not, but at least it begins to contain the growth of Medicaid spending. It doesn't cut it. It contains the growth. That 22 million figure, it's always been suspect. That assumes everybody who's being forced to buy insurance now won't buy it after the mandate disappears. I think if you make a competitive market and you make policies affordable and give people a reason to buy them, more people than expected will buy them.
Yeah, but I think I think Republican leadership though is looking at those numbers from the Congressional Budget Office, and they're saying that they're waiting again for changing the plan just a little bit again to see what those numbers would come back.
Let's say they're off by half. Let's say it's
which they were on the Obamacare.
So you still have 11 million people that you're pushing off. So one of the things that this plan does, at least in theory, is try to fix the exchanges, which have not worked the way we thought. We thought more people would be involved in those. We thought more people would buy plans through those, and they would be more stable. They haven't been. I think the approach that they're taking here might alter that, but it comes at the expense of kicking the most vulnerable people off of any health care. They're not going to be able to afford those plans.
Plan does not kick people off Medicaid.
It absolutely does.
Continue Medicaid spending will grow by $100 billion over the next 5-6 years.
The number that the 22 million that CBO estimates includes all of the people who will be kicked off of Medicare. And again,
Medicaid spending continues to grow. Right. And you know, if you go to a block grant system and begin to contain that expansion, I mean, first of all, Medicaid's crappy insurance. And if you're going to move
to if you don't have anything else.
There's not a study out there that says that it's improved health outcomes, Steve. It still forces people into emergency rooms.
But if you
have primary doctors who will not take Medicaid,
but if your idea is to control costs, right? How do you control costs by letting people have no insurance and deal with
Medicaid is not
primary care through emergency
Medicaid is not working to control costs because too many doctors now won't accept it, and that forces people into emergencies again.
What Medicaid did do was
preventative care.
What Medicaid did do was help hospitals control uncompensated care, which everybody go talk to the folks at Ford or at DMC about how much those costs have gone down. That's one of the cost containment. But that's one of the cost containment issues.
It's doubled the cost for the states.
It has doubled the cost. Government. Well, someone's got to pay.
And so when you look at, but you look at the priority, setting priorities. Is Michigan going to spend less on schools and roads and everything else so it can continue?
How about we spend less on
expansion?
How about we spend less on tax breaks for businesses?
You could restore all those tax breaks, and it won't be enough to cover a doubling in the Medicaid program, which is now 24% of our budget.
I think it's going to be
too expensive.
Very interesting to see how this shakes out. We're not going to see a vote probably until somewhere after the 4th of July.
Never.
Probably never. You think?
I don't think they can. I don't think they can get. I mean, I think.
Yeah.
You've got Republicans.
Actually, I think they'll vote on it because they want the people who said they want to repeal to be able to say they voted
for it and maybe
then let it fail.
I don't know. That's a huge optical fail, though, if you do that.
Will bring it to a vote.
All right, guys, we're going to have to leave that one.